You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. Welcome to another episode of our series, Great Doctors, Inspiring Stories. Women face a unique set of health challenges, from menstrual cycles to pregnancy, childbirth, breast health, and more. It's why there are doctors dedicated solely to the health of women. And at Prevea Health, we have some incredible physicians working every day to keep women in our communities healthy. Dr. Jennifer Milosavljevic, known to most as Dr. Milo, is one of those doctors. Her personal experiences with women's health and the way those experiences have impacted the way she cares for her patients is why we've asked her to be a part of this special series. Dr. Milo, welcome.
Thank you.
I want to start a little bit about some background information about you. You're from the Chicago area. How did you end up here in Green Bay, and how long have you been with Prevea?
Sure. We moved to Green Bay in 2014, and I've been with Prevea almost 9 years now. My husband is actually a colon and rectal surgeon with Prevea, so we ended up in Green Bay for our jobs after he finished his fellowship in Washington, D.C.
Gotcha. And so as an OBGYN, you care for women in so many different stages of life. You know, this includes those who may want to become pregnant or who are pregnant. We know those journeys are not always linear, and they can come with some challenge and some heartbreak. I'm sure you are seeing this on the front lines every day of what you do.
Absolutely.
Now, you've had your own experiences with some of this. Can you tell us more about that?
Sure. So my husband and I realized pretty quickly that we were not going to get pregnant easily because I had some irregular menstrual cycles. So I wasn't ovulating. I wasn't releasing an egg every single month to achieve a pregnancy. So we sought help from a specialist called a reproductive endocrinologist or infertility specialist. And our infertility journey lasted 3 years. During that time, we suffered 2 miscarriages, failed several in vitro fertilization cycles before finally welcoming our twins early at 34 weeks. So at 34 weeks, our children spent a week in the neonatal ICU. So we got to be a part of multiple clubs that we never really wanted to be a part of. And that included, infertility, miscarriage, and also part of the NICU club.
That's a lot of difficulty to experience. I can imagine that was a very challenging time for you.
Absolutely. It was sometimes a challenge to go to work. I had my happy pregnant patients, and here I was, unable to conceive and achieve my goal of having children also. That being said, what it taught me was that I was actually really happy for my patients. I was just sad for myself and my husband.
Mm-hmm. And so now, as a physician, you are seeing women come in facing some of these same challenges that you went through. How has that impacted the way that you care for your patients?
So my personal journey with infertility, miscarriage, and then being a NICU mom has really shaped my career and helped to make me a better OBGYN. As much as I love delivering healthy babies to healthy moms, I really gravitate to the couples that experience their own journeys with infertility, miscarriage, or fetal loss. These are the women that really need my help the most. I want them to know that they are not alone, that I'll be there to support them through their journeys as well. And I want them to know that there is a light at the end of the tunnel, a tunnel that can feel very long at times, especially when you're in the beginning or middle of that tunnel. So I can offer them both advice from a professional perspective as well as from my own personal experiences. And I think that's really helped to guide my career and, again, help me not only reflect on my own losses, but use those losses as a positive to help my patients.
First, I just want to say I'm so sorry for those losses that you suffered.
Thank you.
Tell us how your children are today. How old are they?
They're 11.
Wow.
They're very, very busy with their own schedules. My daughter is a gymnast. My son is a baseball player, so we're always running from point A to point B.
Did I read that you were a gymnast as well at one point?
I did. I did gymnastics for 17 years.
That's incredible.
Incredible. So it's fun watching her.
Another thing I want to talk about is preventive screenings. This is a really, really important part of your job in guiding women towards preventive health screenings such as mammograms. And you have a personal connection to that too. Tell us about your mom.
Sure. My mom, Donna, was diagnosed with breast cancer in June 2019. She had had abnormal mammograms throughout her life and often had to go in to repeat a mammogram screening 6 months later, get an ultrasound, or even have a biopsy. And it had been negative up until this June 2019. This time, unfortunately, her biopsy did come back as a cancer. But we were lucky because we caught it as an early stage 2. So I can now proudly say that my mom is a breast cancer survivor. So a little over a year of treatment with lumpectomy, radiation, a full year of chemotherapy, and she is doing great. It felt like an eternity, but she survived, and she not only survived cancer, but really the anxiety and the depression and the mental health piece that comes with that diagnosis. So I know she's going to be around for a long time to come. She's going to watch her grandchildren grow up, and that's all thanks to early detection and screening.
And how has that experience changed the way that you are speaking with women in your exam rooms?
So my mom's experience has taught me a couple of things. First, it taught me that my mom is stronger than I thought. That woman, impressive. Second, it taught me that life often throws you curveballs, and you need to enjoy life now in the present because you never really know how much time you have left on this earth. As for my patients, my mom's experience often does come up in conversation. I often have patients that decline their screening mammograms. And I explain to them that the point of a mammogram is to catch breast cancer early while it is still easy to treat and to cure. By the time a patient detects a large mass in the breast, it may be too late to cure. And breast cancer is super common and affects 1 out of every 7 or 8 women in their lifetime. And I, for one, will never miss my yearly mammograms. My risk for breast cancer is now over 20% because of my family history. And so I've taken extra steps to see a high-risk breast specialist. In addition to my yearly mammograms, I get a breast exam every 6 months and an MRI every other year. So while I hope that I never get breast cancer, I'm ready if it happens, and I hope to catch it early.
You are also really good at taking care of your health, and that's an important aspect of this as well.
Absolutely. I never miss my annual exams. I never miss my mammograms. I make sure I'm up to date on my Pap screenings. You work out a lot. You eat well. You exercise. I mean, that all plays in. True. I try to get my 30 minutes of exercise in, usually in the mornings because I'm just too tired when I get home at night. And I do it maybe 4 times, sometimes 5 times a week. Just depends on my schedule at the hospital. But try to eat healthy. I do have a bit of an ice cream and chocolate addiction. I'm not going to lie. But everything in moderation, right?
Okay, favorite flavor of ice cream?
Mint chocolate chip.
Oh, that's a good one. That's a good one. You've shared a lot of very personal things here with us. And so I want to first say thank you for that, for being vulnerable. Our hope is to, not only maybe help people who are experiencing some of these same challenges, but to show that not only are our physicians incredibly skilled and knowledgeable, there's something to be said about when you can really empathize what your patients are going through. How I guess, speak to that a little bit.
Absolutely. Women need to make themselves a priority. I know it can be a challenge when we are full-time working moms or full-time stay-at-home moms. I did that for a year. It was the hardest year of my life. Trust me that this full-time working mom, 2 very busy kids gig, it's not easy, and our life is really just a controlled chaos. but it is controlled, which is great. But I know I want to be around a long time to watch my children grow up, and I wouldn't change this life despite the fact that I'm exhausted all the time. I love my patients. I love my kids, my family. They're all a priority, but my health is also number one priority, because if I'm not healthy, I'm not going to be around to enjoy all of that. So that means going in every year for my screenings, my mammograms, and for my 45th birthday, I even gifted myself a colonoscopy.
Oh, that is the best present ever.
It was great.
Well, at least you have a colon and rectal surgeon at home that you can, ask questions about.
True.
If you need to.
True. Thankfully, he wasn't the one doing it.
Yeah.
Awkward.
You bring up some great points there, though. As moms, man, if there are any moms listening or, moms who can relate, there is so much that we are juggling that can't be seen. And whether or not that belongs on our shoulders, it's there for so many of us. And we can't make it work if we're not healthy. And that's what I'm hearing you say.
Absolutely. And if you need help, ask for help. Tell your doctor what's going on in your brain, because again, a lot of my patients suffer from depression and anxiety, and we can help you with that as well.
Thank you, Dr. Milo, so much for joining us here today.
Thank you for having me.
And thank you to our listeners. To learn more about Dr. Milo, Prevea Women's Care, and to listen to more episodes of Great Doctors Inspiring Stories, visit Prevea.com. You've been listening to Plug into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit Prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at Prevea.com. Thank you for choosing to plug into health with Prevea Health.